all. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So, as I always tell you, I always have rock stars who come and increase the ambience of our little neighborhood. So, today I have Dr. Cara Fuhrman with us. She is the daughter of Dr. Joel Fuhrman, who had been on one of my shows as well. This is his book as well. He is pretty popular and very well read and very well respected as well. So, Cara, welcome and tell us a little about yourself.
Thank you so much. Thank you, Dr. Mobeen. So as Dr. Mobeen said, I am the daughter of Dr. Joel Fuhrman. I grew up in a plant-based household, sometimes rolling my eyes at my dad for his, not wanting me to eat out with friends and everything. And then lo and behold, I turned 25 and decided to go to medical school myself. Now I'm 31. I'm a naturopathic doctor, and I love what my dad does. I'm following in his footsteps. I'm no longer rolling my eyes, but praising him. And it's just so funny how the tables have turned. I'm a year into my career and so lucky to have such wonderful mentors from not only my dad, but his colleagues as well. I've learned how to read research. I've learned about a lot of innovative technology and things that are available now compared to what we knew many years ago. And I'm just so excited to be working in this field and educating people on the power of nutrition and how to live a happier, healthier life as a naturopathic doctor that specializes in oncology.
That is amazing. So, a brilliant doctor father, and here is a brilliant doctor daughter as well. So congratulations to both of you, and thank you very much for joining us. So today I wanted to have so many discussions with you about the plant-based diet or the other nutrition things or oncology and food and this QT imaging. So maybe today's discussion we focus on QT imaging and the alternative to mammograms, and what are the features of this product, and then maybe I can request you for more follow-ups as well. So
that would be wonderful.
Awesome. So tell us about this QT imaging. What is this? Why is it a replacement or possible replacement for mammograms? Why is it superior? What is your take on it?
For sure. QT imaging is, as you said, a replacement for mammograms. And the cool things about QT imaging is that it doesn't use any radiation or compression, so it's not uncomfortable. If you've had a mammogram, you know how anxiety provoking it is, as well as uncomfortable. And QT imaging is very comfortable with no radiation. And why it's important that I mention no radiation is because the radiation you get from mammograms is a lot different than the radiation you get from your cell phone, your computer. That's diffuse. It's in the environment. It's going all over your body and in the air. When you get a mammogram, you're radiating an already radiation sensitive tissue directly, increasing your risk for breast cancer.
So
exactly. So that's something that's really great about QT imaging, but it's not even its standout. It's just added perks. So I have to explain something about cancer in order for me to explain why QT imaging is so powerful. If you have a breast cancer, mammography confuses abnormal cells as so if you have abnormal cells on mammography, it goes to a biopsy. And the thing about this biopsy is it cannot tell if these abnormal cells are an aggressive cancer that may kill you and you need to treat with chemo. It cannot tell you if that abnormal cell is something that's benign and will never hurt you in your whole entire life and never cause mortality. So this problem with mammography is the overdiagnosis rate. About 20 to 40% of females are getting diagnosed with a breast cancer that they don't need to treat. And that in the US alone is about 90,000 people each year. That's a lot of people going through not only the stress, the mental gymnastics, the fear that comes with a breast cancer diagnosis, but they're taking treatment that increases their risk for cardiovascular disease, decreases their libido and hurts their relationships, causes brain fog, and just puts them at a risk for a lot of other conditions. So it's important to understand the downfall of mammography to understand the upside of QT imaging.
Very interesting. And I want to just quickly, I do not know if my wife would like it or not, but my own anecdote. I was telling Cara before the show started. My wife and I were traveling to Egypt, and we had a Nile cruise, and the life was happy. And somebody, her doctor called, and he said, "You need to come back. We had done some tests on your mammography, I believe, and we think you have something suspicious, and we need to look into it." So they brought her back, and now we are fretting and we're saying, does she have cancer, or what is going on? And they simply said, we do not know if it is cancer or not, and we need to do more and more and more. So they started doing biopsies, and for 3 months, we were just on pins and needles. She's very brave, so she was not worried, but I was much more worried. And finally, they simply said, "Hey, you are Asian folks, and sometimes the breast tissue is dense, and because of that, it seems like that. And so, all good, you're fine." And I still have not forgotten that scar of 3 months of going through this process. So, with this QT imaging, is there some prevention of such situation?
That situation is extremely scary, and one thing that QT imaging can help, because 40 to 50% of women have dense breasts, which means almost half of the population could have gone through what you and your wife had gone through. And mammography, when you have a mass, it shows up white. What else shows up white is dense breasts. And what dense breasts means is that you have more granular tissue in the breast, and that's what produces milk. So a lot of people have this, it's normal, but both tumors and dense tissue appear white. So imagine that, it's like looking for a snowball in a snowstorm. And also it's important to point out that breast implants also create a similar challenge. So QT imaging gets so much amazing results with dense breasts due to the fact that it takes a 3D image completely around the breast, and it has 200,000 times more data points than traditional ultrasound. So it measures how the sound moves through the tissue rather than just how it bounces back. I like to explain it like a loaf of bread. When you're looking at a tissue on mammography or ultrasound or MRI, you're just looking at the front of the loaf of bread, so you can see a shadow. But it's hard to see it. It's hard to determine what's inside. When you use QT imaging, you're peeling through the layers of the bread, so you can see each thing in every layer, which allows us to have a much clearer picture. And this also brings me into another amazing point of QT imaging, why it's so amazing, is because instead of just spotting shadows like what happened to your wife, we can actually map and measure tissue over time, catching a tumor before it even fully forms. So go ahead.
That's a very interesting thing. So that is something that I think important for the women who are going through this process as well. This is non-invasive, not harmful, and probably more specific and sensitive. And if this test is done, if somebody has a suspicion, do they need to now go for biopsies or others, or they can follow up and have a better idea of what's happening?
This is the amazing part, actually. QT is so precise that we can rescan every few months and track the growth rate of any lesion. If a lesion doubles in 100 days, it's likely to be cancer and dangerous. That's called lesion doubling time. But if it takes 200, 300 days or more, it's benign and we can watch it safely. So that's how we move from what happened to you and your wife, which is fear-based screening, to precision detection. And it means fewer unnecessary treatments, more peace of mind.
That is very interesting. So again, just because it was a traumatic experience, at least for me, my wife just kept actually telling me that, hey, it's okay, life is life, whichever way it goes. But imagine if she had gotten the QT imaging instead of the mammography, would that have created a similar suspicion to say, come back here and we want to do a biopsy right now? Or would that be a little more clearer compared to mammography?
It would be a little bit more clear in the sense of the image is a lot more clear, so you can get a better read of what you're looking at. But again, you might have to come back to make sure it didn't grow. But you have that peace of mind of knowing that what you're looking at is accurate. You're not getting a biopsy knowing this biopsy might not be telling me the right thing. If it tells me I have cancer, I might still not have cancer. Or if it tells me I don't have cancer, I might still. I'm sure a lot of people know someone who's gotten their routine mammograms every single year and still was diagnosed with stage 4 breast cancer that wasn't seen on mammography. Understood. Or vice versa, where people are told they have cancer when it's actually benign.
Understood. So I'm going to once again share this site here. And there are some stats here that are interesting. Callback rates, 15% callback rates with mammography, and biopsies, 10% biopsy rate for callbacks, and cancer incidence, 0.3% cancer diagnosis. So that is a very large number of unnecessary procedures and traumatic experiences. Can you hear me, Cara?
Yeah.
So is this something that is, for example, here they're saying 98% of recalls are avoidable. Mm-hmm. Over 80% of callback biopsies are benign. So this is where QT imaging helps for sure.
Definitely. Yeah, QT imaging reduced non-cancer recall rates by about 16%. Understood. And the cancer recall rate was a lot lower than mammography.
Understood. So now a little more about how do people find this technology, use this technology. So one, it is FDA cleared, and you were explaining that to me a bit. What is the difference between approved versus cleared? So can you tell us?
Yes, definitely. So it's FDA cleared for a breast soft tissue imaging, means it's a safe, non-invasive imaging tool, but they're working towards getting FDA approved, which means it would be a standalone breast cancer screening. And we're aiming for that to expand its clearance, and it's still in clinical trials, which should happen soon.
Understood. And the second thing is, I want to show your site as well for anyone who is interested in getting it. So one, they can just Google QT imaging. And I believe you have started your practice as well with this technology that you're offering. And you always give a disclaimer. So I'm going to give that disclaimer for the cool beans here. I have no strings attached. There is no commission involved. There is no fees or monies that have changed hand. This is Cara's site. So Cara's site is drlongevityrx.com. It is in the description of this video as well. So Cara, tell me, if somebody is interested in this, can they reach out to you? Do you have this service?
So I am in the process of a wonderful remodel. I'm opening my center in October, and what we're doing now is creating a center that is not anxiety provoking. It's not sterile. You don't go there and feel icky, but it's a beautiful spa-like serene environment that we're cultivating for the patient. And we're putting a lot of energy, love, and care into that. It'll be opening hopefully by October 1st. We are currently booking patients October 15th and beyond. And anyone that wants to book now for an October 15th and beyond date, we're offering 20% off, and you can call the number on the website to book.
Understood. And that number is as soon as you open the website, the pop-up is there, so they can easily find it. And I think there is a related question. Svetlana is saying, where are these facilities for QT imaging? Obviously, they would not be paid by any insurance. I would say yet. Which states are they allowed to practice? What sort of radiation do they give? So I think we were discussing this, you and I, a few minutes ago as well, before the chat. Do you want to give some response to this?
Yes, questions? Of course. It's not covered by insurance. That's true. But when you go for a scan and you need to do repeat scans for mammography, MRI, that's really costly. They tell you first to get a mammogram, then they tell you to get an MRI. So it's all relative, and it is affordable. It's about $600 to $750 depending on location. and it's allowed in any state. Not all states have them. There's a few in California. I'll be the first in San Diego. There's one in Irvine. There's one in Novato, California, in Pennsylvania, Arizona. So there's many across the US, and they're becoming more popular.
Understood. So Mary has a similar comment. Will insurance pay for QT imaging? Where is it available? So we just answered that. So that is awesome. Denise says, I went through an awful experience with mammogram and biopsy in 2017 and was clear, yep, dense breasts and allergy to the lidocaine. It literally felt like a radiologist was ripping my breasts off. Yeah, and Denise, same here. The whole process of them calling us back from Egypt to say, we need to see you, that was enough for me to be totally scared. Then over here, we need to biopsy, we need to look at the lymph nodes, we need to do more tests. It was just a very traumatic experience.
And that could have been avoided because QT imaging is so clear with dense breasts that dense breasts won't cause the scare. It'll be less scares for something benign because we can distinguish between dense breasts and implants. In addition, I saw Denise, you said it was very uncomfortable. I hear that from a lot of people. I personally haven't had a mammogram, but everyone says how uncomfortable it is. And with QT imaging, you're just laying face down like you would be on a massage table. And the breast is immersed in a pool of water. And the sound wave goes through the water. It's deionized water that is extremely comfortable. You're just laying there. There's no compression. You don't have to worry about pain. And there's no radiation. I saw that in another question. No radiation with QT imaging. It uses sound waves.
That is amazing. So number one, the experience is great, and then there is no radiation. Plus, I have heard, of course, I don't get mammograms, but I've heard that it is painful as well to get the mammograms. Understood. So, Cara, thank you so much for this. Once again, I'm going to show quickly how can people find you. So the link for Cara's practice is the online site, drlongevityrx.com, is in the description of this video as well. When you go there, there is this phone number, and you can contact her. The technology is QT imaging. Okay, so I'm back here. So I was going to give this example that when I came to US, why I love these imaging technologies with the 3D focus. When I came to US, my very first job was I was working in a company who were building a 3D ultrasound system. And they had these slices and dices, and they would then run various kind of algorithms to produce the body's image there. And that was an amazing technology. And this looks like a specialization of that technology. So once again, Cara, thank you very much for joining us. Any other questions, comment that you would like to address before we close?
That's really cool that you were experiencing some sort of similar technology, because the technology of QT imaging is just unbelievable. It's amazing.
So what will be your recommendation for women who are planning for mammograms? Is it worth seeking a facility where QT imaging is? Is it more comfortable? They may have out of pocket in the beginning, but as another commenter said as well, that overall prices are just not as bad. So what is your recommendation?
Yeah, well, I do not recommend to get mammograms. Large studies have shown that women are up to 10 times more likely to be harmed than helped by screening with mammogram. And not to mention that the CDC even recognizes on their website, they say that a woman at an average risk for breast cancer should be screened from age 40 to 74. But a woman from high risk, that's someone who has a family member or maybe had breast cancer in the past, should get an MRI. And an MRI is something that you have to take gadolinium for as contrast, which is a toxic heavy metal. And the CDC even says on their website that MRI is not for a woman with an average risk, because MRIs can appear abnormal even when there's no cancer. The CDC is even recognizing that the screening tools out there are not great. But we want to be proactive. We want to be screened. So with that being said, look for QT imaging. Get something that is more accurate. Come visit me in San Diego. I would love to have you. And I would love to navigate such a tough topic together, because in today's world, 1 in 8 females have been diagnosed with breast cancer. Compared to the 1960s, it was 1 in 20. It is rising rapidly, and especially in young individuals. I'm 31. I have friends from high school, college that have been diagnosed with breast cancer. And these types of breast cancer in younger individuals are more aggressive. They're harder to treat. And it's a devastating problem we're having right now. So we want to be proactive. And that's why I'm so passionate and lucky to be offering this service.
Awesome. So I have one more question, and then we can break. So Knowledge is Power says, are there good readers of QT imaging?
Yes. I, at my center, will be reading scans. I'm going through extensive training to read scans with QT imaging, but my scans will also be read by radiologists. So just as your radiologist reads an x-ray, they will also be reading your QT scan. And these radiologists will be trained specifically by the company, as well as, of course, going through medical school and radiology residency.
Awesome. So, Cara, thank you very much. Once again, brilliant father and a brilliant daughter. Great work. I would love to invite you again. You are an ND oncology specialized. I would love to talk more about that as well, and other ways to look at cancer risk and to reduce that. Thank you so much for joining us and providing some data for the QT imaging.
I would love that. There's so much amazing research out there about cancer prevention, cancer treatment, and of course, cancer screening. So I hope to be back soon.
Awesome. So gear up for a series, and Cool Beans, thank you very much. Have a nice weekend. Cara, thank you very much for joining us as well. Bye for now.